So excited for John Kettler and Miles Payne to share with you the results of the environmental scan. Guys, take it away.
All right. Thank you, Terry. And nice job, Brenda. If it's all right, I'll set the stage, kind of just a little background for us, and then turn it over to Miles for the meat of it. Some great data here. Really excited about this. For anyone who doesn't know me, my name is John Kettler. I coordinate the Integrated Services Unit for Health and Human Services, and I serve on the design team for the Heroin Task Force. And what we're talking about today is a great partnership with Elevate Inc. and the Addiction Resource Council that we collaborated to do a scan of all of the substance use prevention and mental health programming in the schools within Waukesha County. That goes K through 16, really, because universities were included. So, an excellent data set here. This project's been several years in the making. There is no central repository for this information. There's no sort of state level website you can click on to see what prevention and mental health programming is happening in different schools. You can learn a lot about the different options that are out there, but in terms of what's happening in our county, we haven't known that, and that's been a kind of a bucket list thing. So I'm happy to say that we got there. Initially, this was conceived of as a project, maybe for like a college program, college class, and Miles had a really great innovation on how we can get the data. I'll let him share that. Um, but it's an outstanding data set, 106 different schools, and it's really, I'm excited by this data. It's actionable, and I'm really looking forward to hearing what everyone has to say about it. So I just want to thank, from Elevate Inc., really want to thank Miles Payne, Joy Evans, Brenda Dunlap, Laura Ronitz, Jessica Warden, and Kayla Doge for all the efforts on this, and also the Addiction Resource Council, Family Services. Many thanks to Lindsay Just, Mary Simon, Haley King, Angela Blount, and Gianna Dixon. And also want to thank the clubs that helped with the data collection, and Miles will share about that for us. So I'm going to turn it over to Miles. I just want to say we're going to process this information on the back end. We're very interested in your feedback. What were your key takeaways? And particularly, what do you think are actionable items here? What are the next steps? And we want to make those goals for 2026 and 2027. I got a pad of paper, and I'm going to be taking a ton of notes. So, let's kick it off here, and I'm going to bounce the ball over to Miles.
Beautiful. Thanks, John. John shared a lot of thanks with everybody else, but of course, thanks to John for spearheading all of this. None of this happens without, your leadership and you really setting fire to it. So props to you and thanks to you for making this happen. I was going to present with another staff member of mine. Her name is Kayla. She works with Elevate, and she did she put in a lot of effort and a lot of time in typing and doing a lot of analysis. But unfortunately, she had a family emergency, so she could not be here. But wanted to, yeah, shout her out as well as ARC and again John as well. So getting into how this kind of came about. As John mentioned, right, this is something, there's no repository for this. And so, okay, so is it the college class that does this? How do we make this happen? And at first it was ARC and Elevate just calling schools, trying to get anybody to respond to us. Nobody wanted to respond to us. Nobody wanted to talk to Miles about what's going on at the middle school level around prevention efforts. No one wants to do that. So instead, we came up with an idea of how can we utilize our peers for peers groups in Waukesha County. So if you are unfamiliar, Elevate does a program called Peers for Peers, which is almost like a high school club in 7 different high schools across Waukesha County. Kelly Erickson, if you've met her before, she's on here. She is our prevention coordinator. She runs the peers program in Waukesha County. And so we have kind of a network of both students and staff that are connected to Elevate, but also connected with their school districts around what's going on. So John, ARC, Elevate kind of collaborated, came up with a survey, and then through the peer groups, they were the ones that distributed the surveys to all of the other schools, kind of like a spider web, to actually get those results. And from there, we saw some tremendous, response rates because when people are utilizing their relationships, hey, can you take this? This is really important versus some random person calling. That's where we really saw it take off. So all of that is to say, we have 75 responses that accounted for 106 schools. Just, I mean, I think, Larry, you mentioned earlier about percentage rates. We're super, super happy about this percentage rate. Response rate of 83% out of 128 schools identified, we're super stoked about. But how does it break down by grade? I want you to pay attention to these blue bars on the bottom. So that's your yes, not your no's. You have your unsures at the top and then no data. We see a spike at grade five, and then dips back down, but then seven, eight, and then it kind of dips back down around nine. How I interpret that is trend of highest available grade, right? So if you're thinking of your traditional elementary, fifth is your highest. Is there something kind of out the door, or these are our most mature students in the building, they can handle something, but then back down seven, eight, again, that prevalence is there. And then I think there's still some height at nine being, and Mark, Jody, I think I saw you on here. You guys could speak to this better than I can. Is that just the easiest grade to do something like this? Is grade nine versus the seniors or the juniors, ACT prep, anything like that, right? And as John mentioned, he's taking notes. So this is our interpretation, and we got some, notes at the back end, but we want to hear from you all. How are you interpreting this? What do you see? What do you not see, right? What things are we not currently thinking of? In regards to who's doing that programming, not just by grade, but who's doing it, you'll see that big blue slice of the pie is school staff. We kind of anticipated this, right? That a lot of the school staff are the ones doing it, but you'll see there's some combination. There's a lot of SROs that are doing this, and then outside agencies. Those are your ARCs. I see Mary's on here, right? Shout out to Mary. Those are your ARCs of the world, your Elevates of the world. We're very blessed to do so much with School District Waukesha and some other high schools in the county, but majority of the time it's school staff doing it. And so from them, not necessarily from your Elevates or ARCs, from them, what's the barrier to being able to implement this? You see at the top, that should come as no surprise to anyone, staff time scheduling. However, big shout out, look at that next bar down. 25% responded as there is no barrier. Fantastic, right? That was really awesome to see, is that there is no barrier. So how do we learn from those districts of why is there no barrier? How can we replicate that in other places? And also just continue to fortify and strengthen the fact that there is no barrier. Let's keep it that way. But ultimately, looking at staff time and scheduling, what can we do to alleviate a lot of that? Beautiful. Thank you, Mark. I like that sweet spot. That's a good wording for it. So ultimately, all right, we know by grade, we know who's doing it, we know the barriers. Are you interested in more stuff? I think that was, John, you mentioned that to me. I feel like countless times at the beginning is like, I have so much I want to do, for these schools. I want to provide these things, but what do they really ultimately want, right? So gauge that interest. Is your school interested in resources to enhance its programming? A lot say yes, a good amount say no, and then a lot are unsure. The ability to act on that support might be informing that no or unsure, right? Like, I don't know if I can take any extra support because I already have some time and scheduling capacity issues. So this next slide being Oh, excuse me. So the next slide being switching into the more mental health side of things. We have that substance use prevention, but mental health, 58% of schools are implementing some kind of mental health education. Note a large portion of no data, right? So again, we can't say yes or no. We just have no data. Maybe that's a reluctance to answer definitively yes or no. We know a lot of times we do some mental health education, but it may not be a curriculum that's being implemented. It's just a, thing that's kind of happening, off on the side, here or there. So there might be some, reluctance to answer with that. What are the topics that are being implemented? This is something John really keyed in to a lot is, you see that top bar being general mental wellness. And suicide is not even the second highest, it's the third highest option, right? So over 40 schools are providing general mental wellness, right? Goal setting, positive social norms, coping skills. But, we might need to investigate further as to why only 21 schools report any kind of specific suicide prevention education. So some popularity of mental health programs. How many of you have probably heard of Second Step, right? That's very popular, right? Yep, I see that hand up from Mark. So Second Step, very popular, but kind of to my last, slide, that second bar, teacher researched, right? What does that really mean, right? Are we able to put a lot of, I don't want to say trust, but is that an evidence-based, right, clearly defined program that we can rely on, kind of like Second Step, or is it not, right? So kind of, again, exploring what resources might be out there that we need to explore to, further what types of programs we're choosing in regards to mental health and substance use. So then how many are happening at the same time? The co-occurrence, 53% are doing both, 8% substance use only, 21% mental health only. So that mental health is more likely to be taught alone than substance use. Again, just kind of continuing to, as John mentioned at the top, right, we have no centralized repository of these things. So now, hopefully, in the next couple minutes, right, we can break out into some rooms and talk through why is that, right? Why is the case that some are doing both, some are only doing one, and how can we get everyone to be doing both, right? What are the barriers, as mentioned earlier, and what are the localized factors we need to be talking through? So ultimately, some key findings: substance use prevention reported by 61% of schools, mental health education 74%, implementation varied widely by grade. Mental health education was more common than substance use prevention, but suicide specific education was reported considerably less often than general mental wellness. Capacity constraints and curriculum variability were cross-cutting issues. For substance use prevention, staff capacity was the most frequently reported barrier. I know Mary is on here. John, I would, if you would like, I would love to throw it back to you to maybe talk through some of those parallel barriers or parallel opportunities. I think I've been kind of weaving that through this whole time, but really, if you look at all of those, these are the things that we're hoping, as John mentioned with his, notepad, these are the things we really want to talk through as a coalition, as a community about as we move forward, how do we help eliminate stakeholder and stigma, right? Or stakeholder perception, stigma, right? We have a stigma reduction team. How do we eliminate financial constraints, right? Even the opportunities, partnerships, elevates ARCs of the world, and that program alignment. So, John, I'll throw it back to you one more time. Mary, I know you're on here as well. Mary, please pop in if you would like. And yeah, thank you all so much for your time. Just super excited that this project was able to happen. It was no shortage of work from peers groups to John to ARC to Elevate. So it took a lot of hands, but really happy that it worked out.
Well, thank you, Miles. Nicely done. And really, you were the engine that drove this. You
Appreciate it.
really took the ball and ran with it. Thank you. And as he said, there was a number of implications here. One thing I observed from the previous slide is related to the mental health program. I noticed that I did not see a QPR, question, persuade,
Mhm.
refer, or mental health first aid as one. Sorry, the previous slide. The mental health methods and curricula. Yeah, didn't see either of those on there, and that surprised me a little. So those are ones that have been championed by our suicide task force. So,
Mhm.
something to look at there. Um, but moving back to the implications, what this essentially was that we completed a SWOT analysis. SWOT, strengths, weaknesses, opportunities, and threats. So I didn't want to frame it in quite those terms, but that's essentially, how we processed the data after the initial. So with that in mind, we found some some barriers. Staffing and scheduling capacity was an issue in both. And so these are parallel barriers, meaning that these are found in both the mental health and substance use arenas here. So the staffing and scheduling capacity, being able to work it into the curriculums, having someone available to do it, were barriers on both sides. As were financial constraints. There's perennially a money issue. So having, the right, curriculums or the desired curriculums, the desired times, have been a barrier. And then stigma and stakeholder perceptions. And sort of hit one of the nails on the head. There is historically a perception that discussing suicide in the schools will lead to an increase in suicide in the schools. And I just want to take a moment to say that the data does not reflect that, and that the programming out there has been very helpful, to those schools who have implemented it. So that kind of stigma and stakeholder perception can be a barrier. But there are some great opportunities, and that cross-cut both of these domains here. The strategic use of partnerships, and that could be with our prevention partners, with our mental health providers, with the substance use treatment providers. There are opportunities, and they could be, some can very much address both. And so there's opportunities there. Program alignment, same type of thing. And having different schools, for example, say perhaps one district might all go in on one type of curriculum or something, to have some alignment, all rowing in the same direction there. So that is kind of what we meant by program alignment. And perhaps a standardization of the minimums with some flexibility. And what is meant there is that there is some concept of that there should be substance use prevention and should be mental health programming, and maybe what kind of a minimum would look like, this many hours in each grade, or this many hours in each level, something like that, but with flexibility, so that no one's being particularly prescriptive about how or who accomplishes this. So.
Yeah, and Jody, I mean, we just met yesterday about that very same idea, right? Like kind of establishing some minimums around some high school prevention programming across, the school district of Waukesha, right? So th this work is happening, right? And we see that in the numbers reflected, that there's so much going on that we didn't even know was happening. But as John mentioned, right, bringing that to light, celebrating the fact that a lot of work is already happening, and using our combined community resources to really, fortify and structurally, solidify all the good work that is going on, and provide that support for schools that want to do more, as John just said, with that flexibility.
Awesome.
Absolutely. Well said.
Any questions